important thing we're going to do this afternoon is about 5 or 6 exercises. And I want to explain the rationale for getting there in the first place. But the exercises I'm going to teach you, if you get anything by doing the exercises. That's why we had the space at the back. And ideally, you could use space back there and so on. So let's start with. So the difference between Western medicine and Chinese medicine is, of course, of interest. And I don't know where I read this one time, so I'd love to be able to quote it. But the statement was that Western medicine is difficult to learn, but easy to practice. And Chinese medicine is difficult to learn, easy to learn, but difficult to practice.
I think it was Dr. Shen.
John Shen, right, and he should know. Okay, thank you. So, Western medicine is difficult to learn, Chinese medicine is easy to learn. Western medicine is easy to practice. And if you think of that, well, if you go to the doctor, he gets a test, he doesn't have to do the test necessarily, he might, but he might send you for anything, a blood test, an MRI scan, and so on. He gets the results back, so he doesn't have to do the testing, which effectively makes, in some way, it easy to practice. Chinese medicine, you, the practitioners, are the tests, basically. You take pulses, you look at color, and all sorts of things like that. And you can't farm that out to anybody else, as far as I know. So, in Western medicine, the tests are independent of the practitioner. And what's really interesting is that the tests survive and improve, even if the practitioners die. So, overwhelmingly, in Western medicine, tests are getting more accurate, easier. I'm a type 1 diabetic. At one time, I used to have to prick my skin and so on. Now I can just scan and I can take my insulin, and it's so much easier. So things just get better and better in that way with Western medicine. All sorts of tests are being improved all the time. But in Chinese medicine, the tests improve with practice within the lifetime of a practitioner, but the practitioner dies in the ability and tests go. Does that make sense? Yeah, so everything that you're going to do to increase your sensory acuity and do tests well will die with you. You can't pass it on in your will or anything like that. So I think that's a troublesome thing, because Western medicine is getting better and better and better at a lot of things. And so, like, what is left that you can do and do better than Western medicine? So, the background for today is that in my initial training, I was taught to take pulses and do various things. But the only things I knew how to do was get color on the face, sound in the voice, emotions through interaction, and the odor. And for about 9 years, that's all I knew how to do. And I based my practice on that. I was busy, I had lots of patients, I thought I was a good practitioner, and so on. So that was my initial training. So I had access to J.R. Worsley, which some of you may know the name of, some of you may not. And I used to do, with Angela, we used to get on the circle line and go the whole route and get off the same stop, just to sit and watch people make comments and compare. So a lot of my training, part of it was on the circle line, et cetera, et cetera. So I had roughly 10 years with just treating the constitutional type factor, whatever you want to call it. So there were senses and intuition, but no patterns. I mean, what you think of the TCM patterns, I had no idea of that. And that was fine. I felt really good as a practitioner, and patient-wise, I didn't keep a record in any way, but I really felt I was doing well. So awareness of patient failures, I in China, whereas I said to my doctor there, the first thing, do you use color in the face? He said no. Do you use the emotional imbalance? He said no, etc., etc. So I was up for everything to learn. And basically, I learned about full conditions, and they're really an important part of treatment. And so I knew nothing about it before. So then we created the integration curriculum for the College of Integrated Chinese Medicine. And there was a shift during that time from dependence only on the senses to the inclusion of asking questions, syndromes, differentiation of these, and the importance of full conditions. So what was interesting to me was how this helped people enormously in an integration of the Constitution and the TCM. So there were some unintended consequences, however. One is that sensing declined. Having been pressured in some way to just use my senses, I think it was a relief to people. The college got university assessment, and that did not allow easily for the students' sensory acuity being developed and being assessed. It was just hard to do. We created an exam called the skills exam, and it was partly on video and so on. But it wasn't an easy thing to do for a university-based college. So it's difficult to assess a student's sensory acuity. Patterns and differentiations do not replace the senses, in my opinion. And there were no or very few apprenticeships. So, and there's a strong tendency to believe that our senses are just like everybody else, that we see the same thing. We meet a friend on the street and we say, yeah, I met so-and-so and so on. But then if you ask detailed questions, did you notice his nails? Or did you see this? Or did you see that? And people go, no, I wasn't looking at that. So there's a difference about being in a place where you can see things. Like if you're looking at me now, there's quite a few different points of view, and you'll not all be seeing the same thing, as it were. But later you'll say, yeah, I saw him up on the stage, which covers it, as it were. But it's not the case. So the influences today are the importance of university validation. I discussed with a patient recently who was a student who's graduating, and I said, do you really want the university degree? And he says, well, yeah, because he's going back to his country of origin. So, and I talked about the sensory issue with him. He said, well, I still go for having the degree because it's really important. So we are familiar with what we call head work from previous schooling. When you've gone to school or been to university, you're assessed on basically what you know, and as it were. So there are no acupuncture apprenticeships as there once was. I mean, that's not totally true, but generally speaking, how many people had an apprenticeship with a quotes master, as it were? And we tend to believe we can see, hear, and smell, so why bother developing the senses? And I think that's a really important thing. So I have to ask you, are you more questioning and less sensing? Just if you can assess yourself. Or are you more sensing and less questioning? So I would say I'm more sensing because I had 9-10 years and that's all I did. Plus I got really curious about senses, and it seems to me that's a source of information which is truer, more accurate, etc., etc. So whatever you answer to that. So the question, what would improve your acupuncture more? Better questioning, better information, more books? For example, Giovanni's diagnosis book, I think, is excellent. It's a source of a lot of things which I've learned to actually sense. So, for example, if you take the nails, he has several comments on that and about things. But do you look at them, do you sense them, can you relate it to stuff? And so what would improve your acupuncture more? Better questioning or better sensing? So, you know my answer already. So wonder about that, and my job now is to convince you that that might be the case. So some realities about sensing. I'll read this one to you. It's a quote from an NLP book. It says your ability to perceive something is learned. Now, if you remember babies and prams and so on, they gradually learn stuff about how to take it in and recognize different people. And you can learn to do it better. Most people act as if their senses are simply passive receptacles into which the world dumps vast amounts of information. There is a vast amount of information out there, and it's so vast that you can only take it in and represent a tiny fraction of it. So in this room, in this moment, that's true. You're taking in a tiny amount of the information that's available at this moment. For example, and then the phrase goes, learn to actively select in useful ways. Key is the word useful. So you're practitioners. So what does that mean? One, you learn to perceive. We don't actually just automatically get a camera that works better and better and better every day. We learn to perceive. And so senses are not passive receptacles, not like cameras at all. So one of the models for vision is it's like a camera. But if I ask you right now to turn and look at the person beside you, if you just do that, take a quick look. Okay, if you come back to me, do you have a photograph? There are legends about people having photograph memories. But do you remember what the color was on the person, whether they were wearing glasses or not, and so on? You go, oh no, of course not. So seeing is not like a camera. So the assumption is that often when we're in conversations that you see what I see, and that we actually could do that. That isn't true if you've ever wanted to check it out. People are seeing something different. Two of us walk down the street, meet somebody, afterwards you go, did you notice that? Oh no, I didn't see that, did you? No. And you can argue and joke about that forever. There's a joke in NLP about a couple watching something, and the last part of the film, they actually got wrong. You say, you heard what she said to him. He says, no. And they argued about it and so on. So they watched it again, and at the very end, see, I was right. No, she said, I was right. So we have habits of perception, which don't necessarily make it easier for us to learn something new. And the something is something which needs lots of sensory acuity. So there is a vast amount of information out there. We either unconsciously develop perceptual habits, practice selection, or we do it consciously. So when you come to study acupuncture, you have a bunch of perceptual habits already. And the idea is that we can learn to actively select what we want to see, hear, smell, etc. If you actively select, you have to base it on your purpose, right? I'm going to practice acupuncture. My purpose is to get certain sensory information. And you either do that consciously or unconsciously. My view is that you have to do quite a bit consciously at the beginning. And I'm not sure, from my experience, that it happens. So it also means that you and I, when we appear to be looking at the same thing, are probably, quote, seeing something different. There's a great deal of ambiguity in the use of the word see. So two practitioners going into the same room to see a patient, both asking questions and both looking at the same person and taking the same pulses. will not necessarily perceive the same thing. Unless, oh yeah, this is a familiar thing that you've probably seen, right? So I think of these as acupuncture practitioners having had some engagement with the patient. Now, of course, your training and the sheet you have which you fill in, etc., tends to make this something common. But my experience as a clinical supervisor and just seeing patients with other people, including my wife, and colleague over years of sensory, is that we see different things often. And that's not good enough. You compare that with Western medicine, the tests and so on, it's a bit flimsy. So what are the conditions for increasing sensory acuity? So I began to write these down simply because it seems to me important to be more rigorous about senses than we have been. So systematically get the best conditions. So I'm going to ask you later to do an exercise where you look at people's color. It's not great in here. The best place would be to go over by the door and get actual light and so on. You won't have space to do that, so you'll compromise and you'll do it with bad lighting and so on. Pay attention to the sensory object on purpose. So often my experience is I happen to notice something. If you're training yourself to do something, you have to do it on purpose and therefore consciously, and therefore you accumulate the wisdom. Sensing with sufficient frequency. I know people graduate and they haven't looked at color systematically more than, say, 15 or 20 times. I don't think that's enough. You really have to do it regularly in order to do that. So, comparisons with other observers. That's really a very, very important thing. So to find and use a consistent vocabulary for colors, degrees of, and so on. I'm amazed at the fact that you want a room painted. You go to a color chart in a paint shop and choose from 150 colors. And you can take that swatch and they'll paint your room and it'll be roughly the same color. Whereas we have nothing like that in looking at the human face. Plus we have different races and so on. So color seems to me really important, and it's a very flaky process, and I'm going to hope to put you through that later. So learning to use scales and norms, say 1 to 5. So to quickly determine significant observations. You'll do an exercise shortly where you actually take someone's hand and classify it as hot, warm, normal, cool, or cold. So the reason for that is that many observations aren't important. They're not on a scale, as it were. So having a ranking is a very useful thing. It makes your sensory observations much more quick in an important way. And I hope to demonstrate that later. So scales indicate significance in that way. So what are some conditions for increasing sensory acuity? And this one was using filters. Now a filter is, if I said to you right now, I'm going to put a filter in your mind, just as an example. If you looked around the room to see whether there's anything that's orange, so have again. Around the room. Yeah. Is there anything orange? Now, I would outrage you if I said, did you see anything green? And you go, come on, you asked us to look for something orange. You'd be annoyed with me. But that's putting a filter in your mind. That means you're looking for something specific. And that's a really important thing. And we'll talk about filters in a moment. So you learn to produce observational sequences or routine, which may combine 3 to 5 observations and make them fit your diagnostic process. So the last exercise you're going to do is to put a routine together and go to 2 different people and see whether you can put it together. In my opinion, routines are essential because your collection of sensory information is tricky. You're sitting talking to a patient and you're collecting sensory information. It's hard, right? It's not easy to keep chatting, keep rapport, etc., and collect sensory information. So, if we go to what filters are what we allow in. My asking you to look for something that was orange was an example of that. So, we won't do that again. And then, oops. Yeah, filters are useful in making perception more purposeful and effective because we can't sense everything all at once. So what that means is perception in a practical way is, what should I say? Perception is selection. I repeat, perception is selection. If you walk out of here with nothing else, that's important. You can walk out of here mindlessly, or you can walk out of here with a purpose. I don't recommend you necessarily walk out with a purpose. Walk out mindlessly. You're relaxing and you're having a good time meeting friends and so on. But if you're in practice, basically, you need to know that perception is actually selection. So we could be responsible for and be able to change our own filters. So filters is what we decide to let in. So if we're looking for something specific, which would be a color or erythema around the needles when you're tapping for aggressive energy, facial color, you're doing it on purpose, and that's the essence of that. So looking only for differences or for changes. For example, you all do this now, I think, which is that you take people's pulses, record them in some way, then you needle, and then you may go back to the pulses. When you go back to the pulses, you're not doing the same thing as when you first took them. You know, that's obvious, yeah. So what you're doing is looking for changes and the significance of the changes. So you already, does anybody not do that? Okay, so you already have that automatic filter change. When I go back the second time to bake the pulses, I'm looking for changes. I'm not looking for what I wrote down the first time. I'm looking for what's different. So if you put the tongue on the roof of your mouth, you will increase your sensory acuity because we tend to chit-chat to ourselves most of the time. So you can try it right now, but that's something I think is a useful way of changing your filter. And we're going to do an exercise, so I won't talk about this one too much. But if you let your attention go from your eyes down to your heart and up to your heart again, and kind of open that as a channel, you will see differently. And I hope when you do that in a few minutes, you'll notice the difference. You can also slow time. When you slow time, those small changes when not everybody will use the phrase emotion testing, but when you actually interact with somebody and you're watching to see what happens on their face, we're slow. We can only see things at a certain pace. But by learning how to slow time, you can actually make that faster and be quicker in that sense. So, have you ever tried to swat a fly with your hand? They go, they're fast, right?
Yeah.
If you get a fly swatter and the end of it moves much more quickly, you may do it. I come from Canada where in the summer flies were a nuisance and we were always trying to swat them and so on. But having a fly swatter makes it much faster. Flies have a different time perception than we do. Interesting book on the perception of time, which I read recently. And the question was, how long is now? So I'll tell you the answer in a second, but how long do you think now is? You know, somebody says, right now. Well, it's testing various things, and it turns out it's about 3 seconds. And then you're into the future or talking about the past. But we all have a different time space, but people have one, and you need to be able to change it in some way. So, filters can take time to develop. For example, when you're interacting with people emotionally, first time you do it, you just go, well, so they responded in that way. Later, you learn to respond and go, ooh, that's an abnormal response to a challenge of some sort, to do with anger or to do with joy and so on. So sometimes it takes time to develop a filter. Sometimes it doesn't take any time at all. I just say look for things that are yellow, because supposedly we all know what yellow is. You're the only person here that I can see with yellow. So filters develop quicker when we work with others, make comparisons, and sense deliberately. So I'll repeat that because it's very important. Filters develop quicker when we work with other people, make comparisons, and sense deliberately. What if we don't agree when we do sense things? Not to worry, the more you compare, agreement begins to be possible. So sensing becomes a habit. Are you more visual? Are you more tuned into sounds? Are you aware of odors? And can label them? Or are you aware of body feelings? So one of the important things is you meet a new patient, you sit down with them. Immediately you have some response to them. I like this person, I don't like them, I'm curious, why are they fingernails dirty, and all sorts of things. So we have bodily feelings that are an important source of information. So this is something, I'm not going to try and prove this in any way, but I think intuition develops as sensory acuity develops. That's the difference between having a wacky idea and having an intuition. My example of an intuition was I was once with a patient. I thought they were a fire constitutional type. I decided what points to use. I went back and got my needles and I started to walk towards the patient. And I went, oh. And I changed my diagnosis in the middle of it, went to a different part of the body and treated it. And I was correct, because the patient got better on that particular element. So intuition is really important, but you want to be able to distinguish intuition from guessing. This is what we're talking about. So sensory acuity develops intuition as opposed to guessing. Knowing one is in our body and we are not consciously aware of it, but it might pop into consciousness as knowing two. In the example I gave, knowing two is when I looked at the patient and went, my whole diagnosis is wrong, and I just treated something different. But it's only sensory acuity which gives us the ability to be intuitive. So how many people here feel they're relatively intuitive in the treatment? Yeah, it's a reasonable thing to do. But if it wasn't based on your sensory acuity and developing that kind of extra awareness of various sensory things, I don't think your intuition would be as good as it could be. In other words, I think it would be as guessing. I'm familiar with guessing in my history. So intuition comes by developing senses and letting them work unconsciously. Pseudo-intuition is just guessing. And it's hard to know the difference sometimes. You got a feeling. So sensory acuity is the basis of intuition. So sensory acuity defined in a specific context, because sensory acuity is context dependent, which defines purpose and use to make relevant and finer sensory distinctions. For example, in an acupuncture context, to make finer and finer movement, color, sound, odor distinctions. So compare acupuncture and accountancy. Do accountants need sensory acuity? Not so much. Certainly not as much as an acupuncturist. Compare acupuncture and a landscape painter. So landscape painters can look at a landscape, take a brush, paint, so and start to record something. I recently have been on basically 3 drawing painting courses. And we were given a duck to draw once, a duck sitting on water, a photograph of a painting. And so that was the way we practiced quite a bit. And before we did it, the teacher sat us down and said, "Now look, you need to pay attention to this, this, and this." And she said, like in this area, and she pointed to it, she said, "There's some red in there and some." And I was rather shy in the class because everybody was a better draftsman, painter than I was. So I put my hand up and I said, "Excuse me, I can't see any red in here." And she said, "Oh, yes." I thought, "What's wrong with you?" So she said, "Watch for a second." And she took 3 different colors, one of which was red, and put it in that place where and then put the other colors in. And I looked and said, "That's exactly the color that's on the wing of the duck." And I said, how did you know? She could look at colors and do things that I had no ability to do. And I thought I could see colors. It's context dependent, and it's dependent on your training over a period of time. If your parents kept you in the cupboard when you were a son, I think you won't develop sensory acuity. If they took you out outside and so in various places where there's a lot of stimulus, then you will be doing better. So I think everybody should have one of these. This is the things that you would sense, that I would sense. And this is a random list. If you photograph it, you should make your own list. That's a really important thing for you to do. And get good at each of the things on it. But this is just an example. And visual, V is visual, T is tactile, when you touch, auditory, and olfactory, which is smelling. So there's all sorts of things. Listening to coughs is very important to me, but it may not be something that you want to get good at. So the only way you're going to get good at that is probably record coughs and begin to go, okay, that's indicating a very full condition. This is indicating a deficient cough, which would be the distinction you want to make. So in the handout, I do have some handouts which I will leave out afterwards. When you look at this, make your own list. These are the things I want to be able to sense, because that's the way I work. I will increase that list if I can. So you have a list of the things you want to sense. So exercise 1. What time did we start? 2:30. Okay, we're sort of on schedule. I want you to wander and find 2 others and make a threesome. You can go into that corner over here or into the back. So you get a threesome of A, B, and C. Find the best light that you can get, and each of you records the 2 others' predominant face color. I would go for what's around the mouth or beside the eyes. So that's your task, right? You're going to have 2 other people, and you're going to record the color. And record the facial color as pale, lack of red, which is a nonsense color, but it was taught for years and people still talk about it. Or pale and dull, or red, or yellow, or green, or blue, black, or white. Obviously the elements, and maybe blood deficiency. Then and only then compare results. So A and B compare what color they saw on C. So we're going to see whether you see the same thing. And that's the exercise. Do you get what you're going to do? Okay, you have about 6 or 7 minutes, ideally, to do that now. And what I'm going to ask you is, how was the agreement? What was it like? And so on. So grab a couple of people. Oh, okay. There's a part of me that is an intolerant, impatient son of a bitch. And when you talk, you're not inclined to use your senses. I mean, you can, but chatting about what happened is, I'm going to be really rude, it's a bloody waste of time. Actually doing the sensory acuity, you either see it or you don't, you can compare with others, and then stop. It's hard to do, I know, but I apologize for being so intolerant, but time is an issue right now. And it is later too for you, depending on how much time. So the second exercise is find someone, one other person, and chat for no more than 15 seconds and notice the eyes for spirit or luster. This is a really important check. Worsley wasn't the only one that talked about spirit or luster. Basically, it was a really important thing for him. It's also important for Chinese practices, even though in my experience what I saw in China was not the case. But spirit luster is what is something you might make the difference. If someone's spirit or luster is weak, then basically they have less chance of getting well unless you direct your treatment more to that. So what you're going to look for is noticing the other person's eyes, and we can do this one in this room. Each of you records the other's spirit or luster as very strong, which would be good, strong, which also good, normal, or weak and very weak. And it's a really important issue when you treat someone to make that judgment. So we're just going to kind of do it in a short way. Do it with two people and do not discuss your judgment. So this time you actually just meet with someone, they'll know what you're doing, okay? And that's okay, you just have maybe a 15-second interlude. You may chat, but that's okay. But then go and write down where you find them on a ranking scale.
Do you think it's possible to do this through glasses?
To
do this through spectacles? Do you think it's possible to state that through spectacles?
yes. You take yours off if you want, but no. Yeah, because the pattern, which is, I think, inherent in this, is something you'll feel it more than anything else. Like, ooh, I have seen people where I go, wow. You know? And there's a thing called false spirit when people are definitely possibly dying or very unwell, where they have a moment of being very bright in that way. But you guys are not dying at the moment, right? Okay, so try and record it as faithfully as you can. So with two people, just go and do it, record it, and come back. You are not allowed to talk and stuff. You may do this more than once in a session with a patient because things can change. Sometimes people will burst into laughter and it's hard at that moment. But if you do several times, you can begin to go, I begin to notice that the spirit is weak or that it's really strong. So it's an important piece of information to collect. And so the next one, this is a visual thing, but it's to do, whoops, not the same. So, exercise 3, ranking, comparison, tactile, and temperature. Okay, so you make a group of 3 to 4, one at a time, and hold up the left hand of the other 2 or 3. This is the thenar eminence, and you're going to look at it visually, and you can touch it. Okay? And what you record, oh no, just a minute. Sorry.
I mean,
Yeah, hold the left hand of the other two or three. Just all use left hand and record the temperature as hot, warm, normal, cool, or cold. So just check whether there's agreement. So if these two people are with me, and basically we do it, we check whether we agreed as to what our rating was. If you agree, fine, but if not, just revert to making a comparison between the other two. Which one is warmer, which one is colder. So, is that clear? So first of all, you don't access other people's thing. When you do, if you agree, good. But otherwise, just take a comparison between the 2 or 3 other people and go, this was the warmest one, this is the cooler one, this is the one in the middle. So you're actually just holding one hand. Now you could apply this to the whole body, but basically we're just doing a very simple one. So make the comparison and see whether you get agreement or disagreement. You come back? I'm not really good at just being a bully, but I'm going to do it. So, did you get agreement?
Yes.
Yes? No?
Yes.
So this could apply to the whole body, but I'm just picking pieces to get the idea of how working with other people and comparing your senses will give you a greater awareness. If you had, for example, 3 other people with whom you could do this and find a place to do it with other people, it would be a great thing because you actually need, I believe, this kind of practice to get better and confident that what you're feeling is out of balance in some way. Okay, so this time, so just examples of ranking. It could be temperature where 5 is warm, 5 is very warm, and 1 is cold. So having ranking in mind simplifies the issue. You don't have to feel it and go, oh, that's not quite right, and so on. You actually have a ranking, and it gives you more power to be quicker and do several things in sequence. So moisture, dryness, you could have done the same exercise with the hand. Just feel it as you shake a person's hand and get the moisture or dryness. Some people's hands are wet, and you have to then start thinking, well, why is that hand wet, or why is it very dry? If you shook my hand, take a guess. Do you think it would be dry or wet? Dry. Yeah, it's not. So it fits into the overall sensory appreciation of the person. So with fluids, if you also shake the hand or touch the arm is a good one. You touch it here and here and go, how much fluid is in there? And you go, there's not much. The skin feels dry. 2 observations in 1. But sometimes people are full of fluid and you can feel that and go. So then that is in your mind and it has to fit in somehow with the rest of the diagnosis. For people who only treat one element, which is what Worsley taught, this will shake that up in some way because it will give you a bigger picture which you have to put together in the end. Okay, so that's the other ways of using ranking. Okay, same thing. We're going to use the thenar eminence of each hand. Each person ranks whether the thenar eminence is fullest. That means good muscle tone. And which is the least full. These 3 would be the least good muscle tone. That is the most atrophied. If you want to look at mine later, that's probably a 3. Those muscles are atrophied, and that's happened in the last years, and it's certainly got to do with it. So the ones you feel may be close, then compare your judgments. And if you wonder what the meaning of that is, I'm going to be mean person, I'm not going to tell you. But if you look at Giovanni's diagnosis book on page 1056, you'll get the significance of it. And it's not age or it's not. And I was surprised in reading his book that that was significant. But it applies to other areas too, because these are muscles. Okay, so you know what to do. Group of 4, each person hands, the first one is each of 3 people hand it out. You get a chance to look at it and touch it. Look at it and touch it. Look at it and touch it. And make your judgment. 1, 2, or 3. Off you go. Charlie Bach. You're the guilty one because I think you're doing something in addition. Okay. Good. Okay, so, did you feel differences? Yeah. The most important thing is to be able to feel differences and then begin to know significance of and so on. So, anybody when we're finished wants to shake his hand or just look at it and so on, you'll see that I am declining in a certain way, and you will know it. My practitioner who never looked at it treated me on that particular issue last time. How he did it, I asked him, and it gets complicated. But it's a piece of information that could be really good, useful. Okay, so we're going to move on.
Hang on, what's on page 1056?
Yes.
What's on page 1056?
What's on there? I'm not going to tell you.
Go buy the book.
Expensive way of finding out.
Giovanni Macciotto's book called Diagnosis in Chinese Medicine.
Is this a good diagnostic tool that we should use? Or is it just an interesting thing to do?
I think it's interesting. It depends how far you want to go at the beginning. So I'm not a Earth constitutional type. But if this indicates something to it, my practitioner the last time, 2 times I've been treated me with that in mind. So I don't know how he got there. I'm going to ask him, because we're quite free in discussing those things and so on. But the things that accumulate, and if you can do the sensory sensing quickly, but that requires practice, and it requires, like in the end, we're going to do 3 in a row, all at the same time. Not exactly at the same time, boom, boom, boom. So when you get good at that, you just can collect more information quickly. And, yeah. Does that answer your question?
No.
It is in the tradition.
Ah, right. This is, yeah. Charlie's just said it.
Charlie answered.
He said, yes.
Sorry.
It's in the
Sorry.
tradition.
Sorry, you want to?
And the sense, I think the question was, is this a nice thing to do, or is this part of the classical tradition of Chinese medicine? And I think that it is part of the classical tradition to cultivate the femur and evidence.
So I often think about the first people who did acupuncture. How the hell did they learn all these things? Through practice, because they didn't have books. Now we have books, we get lazy in a certain way, and we don't develop those things. I won't rant anymore. So, exercise 5, filter visual spirit. So, using a minute, sit for a minute with your eyes closed, don't do this yet, and just trace a line from your eyes, feel your eyes down to your heart. Trace a line from your eyes down to your heart and back up. What I'm asking you to do is to wake up a channel from the heart up to your eyes. Now, after you do that, be very quiet, do not talk, and walk around and look at 3 or 4 others and to get something about their feeling state. Find out if the opening of the path from the eyes to the heart gives you more or different information or feeling. And if so, ask yourself, what kind of information was that, and was that useful? So basically, what I do is sit for about a minute, just try and make a connection from my heart. You may put your hand on your heart, just go from your eyes to your heart, and then get up and wander and just look at other folks. You may be shocked by what you see. That's kind of my hope, that you go, wow, that's different information. Because if it is, what kind of information is that, and why weren't we seeing it before? So when you've got that channel open, just stand up and walk around and look at other people straight in the face. Do not talk. When you're ready, my experience of this was that I would do this before I went out for lunch, and I have about a 10-minute walk to where lunch is, and I would just watch people from this point of view. At first I didn't think it did much, but the closer you are to the moment you open your eyes. So I ended up walking down the street, closing my eyes, kind of doing it so I'd be closer. Then I'd open and watch people. My first experience is I didn't want to walk to lunch doing that. I didn't like what I saw, and it wasn't as happy, pleasant, or as usual. So, being me, I did it more and more to see whether you can get it. And it accesses to me different information. So first question, who got a different feeling hit when you do it? Okay, most of you will. And this next thing is, okay, keep practicing so you can actually get that change. And thirdly, then you begin to interpret it, because you're seeing something that you've been filtering out. And it's perfectly fine. You can't live, certainly I know I can't live in the ordinary world seeing accurately what you see when you're looking at somebody else's eyes. I just don't want to do it. So in terms of burnout, et cetera, use it frequently or practice frequently, but be careful in doing it. So can somebody describe to me, with their hand up, what is the difference when you see having woken this up? Thanks.
For me, the primary difference is the connection with my heart. I come back into the now, into the presence, into myself. And from myself, I see so much more when I look out than when I'm coming from the chit-chat in my head.
Okay. And I'm going to come back to yes.
For me, the Shen seemed to shoot out much more quickly.
Yeah.
I feel like you hear something that isn't actually being said, coming out of the person.
That's a very interesting thing to say. Correct me if I'm wrong. You hear something that's coming up.
Yeah, it's like an unspoken voice coming from deep inside of you. You hear.
Do you hear words, or do you just hear a sound?
More that feeling, a sense of who they are that maybe they're not displaying.
Okay, what's interesting there is he's not one sense anymore. You said hearing and feeling and seeing. That's an interesting place to be. You may not want to be there all the time, diagnostically, but it is useful. Jane?
My feeling was more in my body. I had a very strong kinesthetic
Yeah,
feeling of the emotion that was coming from that other person.
right.
So I felt fear, and then I felt grief for somebody else, and then I felt joy, and each emotion is really powerful.
Yeah. So, why become an acupuncturist if you're going to operate in that way? So it's something you need to know how to access and how to not do.
Yeah.
So I think with a lot of filters, it's like that. You need to know when to open and when to close, and not necessarily do it. Any other response?
I like the fullness, like a warmth, and like sometimes like a more of a closedness, more like guarded. Just like a wave.
Okay. Practice it in a gentle way with yourself. Just explore what it can do. Because you deal with, Western doctors don't need to do this. I think what we can do is so different from what Western medicine. It's the same and different at the same time. Having that greater sensitivity is quite important. Okay. So a routine is where you don't just do one of these things, you do 2 in a row or 3 in a row. So I don't expect this exercise to be easy, but I'm going to ask you to do a routine now, where you just something that fits together. So you would have a different routine if the patient is on the couch. And this is the assumption that you're meeting the patient for the first time or sitting in a treatment room talking to them. So I want you to get 3 things you're going to do in sequence. So that means bang, done, done. Because you can't do them at the same time. I'm quite convinced of that. But you need to go from one to the other. So the virtue in this is time, to be able to do boom, boom, boom. And remember, and write them down. So if one of them is significant, be able to write it down. If the 3 are significant, and being able to remember and write them down is a very difficult thing to do. So, you can judge your routine that you can do it smoothly, and don't judge yourself today. That the number of sensings you can do, either 2 in a row or 3, and to be able to remember afterwards. I don't say this is easy at all, but with practice, you should be able to do it. So you also need to be able to say if any of those readings were clinically significant. And the ideal is you get the process so that it's automatic, so you can do it. How many times do you have to practice this to get it to be automatic? I'm not sure. It'll take quite a few to be able to do it. But it's a gross thing to say. It's just so much more efficient to be able to do in sense in that way quickly and in an order. So what we're going to do, create a routine which is both visual and for temperature. So you try and collect the 3 sensory objects: facial color, hand temperature, and spirit luster in the eyes. So these are things that we've done, but now you're going to connect them together and to be able to do it smoothly and quickly. I have to say I don't think this is an easy thing to do, but it would be an indication. Maybe some of you can do it. Great if you can. But it would be an indication of things to work towards. So your actual sensings are conscious, purposeful, and can be rapid. So by the time you sit down, you already know quite a bit about the patient. And you should record that and then go on with the further thing, which you would maybe do sitting. So, you've got those 3, and write them down now in the order in which you think you're going to do them. So I want you to imagine doing it. And as you imagine doing it, you go, well, the visual one I can do before I hold the hand. The hand temperature is when I'm holding the hand, and the spirit luster in the eyes might be something you would do just at the end. But you choose. So I'm asking you to anticipate how to collect this information in the order in which you do it. So by now, whatever, write down an order in which you're going to do it. So you're going to longer meet someone and collect the information. The interesting thing is the other person will be doing the same thing. An advantage is with patients or other people in your life. You may do it and they're not knowing what you're doing. Not a big deal. Practice is the important thing. So decide on the order beforehand. Remember your results so that you can write them down after. If you can't write them down, don't be hard on yourself. Because to be able to do that and remember and write down is very, very, very complicated. So, and do with two different people, but there was a question first. No? Okay, go for it. Oh, sorry. Oh.
Give an addendum, because it's been observed by psychologists that we can easily hold 3 bits of information in our minds at any time. As soon as we add a fourth, we get in a muddle. And I've tested it many times with myself, and it's true for me. It's sense from university.
You can see really reading out.
No. But it said 3 is doing.
Okay. So, Michael confirms that 3 are okay. But don't be hard on yourself. You try. 5 minutes left, so go for it. So I can remember being so nervous with each patient and so on. The nervousness doesn't do it. So you have to practice off-piece, does it, or so you can do this and then be able to do it with patients. You may feel it's a little like, you know, when you meet your patients, sometimes you give them a hug, sometimes you say hello and chit-chat and so on. So you're going to feel odd doing something else at the same time, if you can. And that's an issue you're going to have to deal with yourself. You may go, well, I'll do the hug and everything else, and then I'll actually get into my senses. Or I don't know how you're going to incorporate it. It depends on your own personality. So I have about 1 minute. Is there any feedback you'd like to give me?
I think you were very good, John.
Could you say it again?
I think you were very good.
Any other feedback? Sure.
Lady's comment about doing things in threes. That was a big thing in the army. You always explain things in threes, because you can manage 3 items and they can't manage more.
He understands what you said. Okay. Okay. Thank you very much. And enjoy.